I'm Steve Marshall, Visiting Associate Professor in the Department of Orthodontics at the University of Iowa College of Dentistry. This video is a short summary of our paper entitled Chin Development as a Result of Differential Jaw Growth, appearing in the April 2011 edition of this journal. From the study of anthropology, we know that the chin is a facial feature unique to modern humans. The bipedal primates that preceded us lacked a prominent chin. In fact, they had what we would term a receding chin. So why did the chin evolve? The evolutionary explanation is largely viewed as a necessary change in the mandibular architecture due to altered facial biomechanics, the development of articulate speech, and the reduction of tooth size occurring during the evolution of modern facial form. However, looking at this question from the point of view of facial growth, a different theory may have merit. For example, from the study of facial growth, we know that during the downward and forward translation of the jaws, the forward displacement of the maxilla is less than that of the mandible. Yet, the pattern of occlusion remains stable during facial growth. This phenomenon is termed the dentoalveolar compensatory mechanism, in which, during facial growth, teeth and alveolar bone are displaced along the corpus of supporting bone to maintain interocclusal relationships during differential maxillary and mandibular growth. The purpose of our study was to investigate the hypothesis that the chin develops as a result of this mechanism during facial growth. We tested this in a pure longitudinal sample of untreated Class 1 subjects from the Iowa Facial Growth Study. We did this by measuring the forward translation of skeletal and dental landmarks in the maxilla and the mandible relative to the forward translation of pagonion during facial growth. We used this approach because pagonion has been shown to be a stable reference point with little or no apposition of bone during facial growth. We have two principal findings from our analysis. One, bony chin development during adolescence occurs in part from differential jaw growth and compensatory dentoalveolar movements. For example, we found the change in position of the mandibular incisors accounts for 62% of the variance in chin development during growth. Two, the relative change of the position of mandibular dentition predictably followed the relative change in the maxilla and the maxillary dentition. For example, we found that the change in maxillary incisors and first molars during growth explained 72 and 76% respectively of the variance in mandibular incisor position during growth. Finally, our findings suggest that the evolutionary development of the chin may be linked to an evolutionary reduction in facial projection through the dentoalveolar compensatory mechanism. So I encourage you to read the paper for a broader discussion of our work. Thank you.